At midnight on March 31st, the emergency COVID measures that were introduced 2 years ago in Ireland were finally removed. Curfews, mask mandates, and travel restrictions have all been gradually removed over the last 3 months, but all restrictions were officially lifted last week. Through the Health Act, Ireland's government was able to utilize its emergency powers to impose lockdowns and other COVID restrictions during the last 2 years of the pandemic to minimize the threat of COVID-19. Healthcare worker Emma Lambert recently traveled from the United States to Ireland and was surprised by the lack of travel restrictions to enter into Ireland.
Surprised me in the sense of there's absolutely nothing, and at the very least with coming back into the US, we have to take a test and be negative.
The lifting of COVID restrictions and the lapsing of emergency powers all point to Ireland entering a new phase of the pandemic, but COVID-19 is still very much present in the country. In Ireland, there has been about 2,800 cases and around 1,300 hospitalizations reported in the last week. Over the last month, the country has been experiencing its highest COVID spike in the past year.
We have these mandates for a chunk of time, and as soon as numbers start going down, we go, okay, we're good, we can take the masks off again. But we don't wait long enough for them to stay low.
Despite the newest spike of COVID cases, the Irish government has said it will not reinstate emergency powers to impose new COVID restrictions. Reporting for Temple Update in Dublin, Ireland, I'm Paige Hakowski.